Hi, my name's Sally Gapper and I'm the Voscur rep on the Bristol Health and Wellbeing Partnership Board. I attended the last meeting, which was the second meeting that the board have met on the 17th of March. The main items on the agenda was to agree the work programme for the board, the membership of the board, and to look at priorities for the coming months. I've been asked to represent the Health and Wellbeing Board on the recently established recession group, which I think is going to be really useful because obviously as my background working in the advice services, I can report on the day-to-day impact that we're witnessing, and advice services across the city are seeing a huge increase in demand on their services, particularly around debt, housing, repossession, also unfortunately increase in domestic violence and other related issues, and we're struggling to cope with the demand at the moment. The board discussed and looked at various health strategies that are being developed across the city. In particular, Christina Gray from the Health Service reported on her strategy, which is looking at access by BME groups to health services, and she's going to do a presentation to the board, so I'll be able to tell you a bit more about what that's all about after she's done that. A new Healthy City strategy group has been set up, and I think that's both Bristol City Council and the NHS are working on that together, and the board has agreed to give support to this. Another group has been set up around healthy workplaces, and again I think that's a joint activity between Bristol City Council and the Health Service. And the board has asked 6 different presentations from other partnership boards, for example the Older People's Partnership Board, Physical Activity, Smoke Free Alliance, the Alcohol Strategy Group and Active Bristol, to all give presentations to the board so we can assess where they're at and how they're going to take their work programmes forward. In particular, there was a presentation from Netta Meadows, who is looking at the targets, and in particular she's been told to develop a work plan to tackle looking at the worst indicators. So the first presentation will be from the person who's responsible for the targets on bed blockers. So if people are medically fit but they can't leave hospital because of a social reason, and apparently we're not performing very well on those targets. And I was able to point out at that meeting that in fact 4 advice agencies are funded by the PCT to help with those cases, but the referrals are not coming through, so hopefully we'll be able to do a bit more joined up work in there. One of the positive things that was discussed was this promoting free swimming for under 16s and over 60s, which is excellent, and I'm sure we all support that. However, I've got a couple of issues around accessing how you can get your free card to do this. It seems to be that there's going to be very limited time when you can go to your local swimming pool to get your free active card. And I think that raises access issues. A, for people who've got disability, are they going to be expected to stand for 2 to 3 hours in order to get their card? And also, if you're going to have to provide a lot of information, identity, passports, that's also going to affect a lot of clients who could really benefit. For example, our Somali clients that we see here rarely have any paperwork to prove their identity or the age of their children. So I just think that there are issues around that, and it's something I will be pursuing with the board. The date of the next meeting is Friday 15th of May, so if anybody's got any particular issues they want me to consider or to look at, please get in touch.